Hello students, this is Dr. Deptee Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. हमारा आज का टॉपिक है प्रोग्रेसिव रेजिस्टेड एक्सरसाइजेस. Progressive resisted exercise is a system of dynamic resistance training in which a constant external load is applied to contracting muscles by some mechanical means. We can use free weights, we can use weight machines. So we are increasing the weight mechanically. So progressive resisted exercises increase muscle performance and they increase the amount of resistance used in the exercise program. In this technique, the progressive resisted exercise, the contracting muscles are overloaded by a constant mechanical external load. Here what we are basically using is called as repetition maximum. Now what is this repetition maximum? We will be discussing in later slides, but it is the greatest amount of weight a muscle can move through the range of motion a specific amount of time. The repetitive maximum is used as the basis of determining and progressing the resistance. So progressive resisted exercises use many ways to achieve this increased resistance. Firstly they can increase the weight you are lifting, do the same number of repetitions at sets each week but increase the weight. Secondly, you can increase the number of repetitions, use the same weight for the each workout but increase the repetitions each week. Then increase the number of sets each time you work out, shorten the rest time between the sets, or use the same weight as repetitions but slow down the exercise. By this you can use these techniques. However, a systemic review of literature in 2005 indicated that progressive resisted exercises also were beneficial for patients with a variety of pathological conditions, but they are mainly used in musculoskeletal injuries, osteoarthritis, osteoporosis, hypertension, then adult onset type 2 diabetes, then chronic obstructive pulmonary diseases and other conditions. So we can use these exercises in these following techniques. So what are the principles? First is to perform a small number of repetitions until fatigue. Second, to allow sufficient rest time in between. Rest time is mainly for the recovery. Thirdly, to increase the resistance as the ability to generate force increases. So I told you we have to discuss about the repetition maximum. A repetition maximum is the most weight a person can lift for a defined number of exercise movements. For example, 10 repetition maximum would be the heaviest weight a person can lift for 10 consecutive repetitions. Repetition maximum is a good measure for person's current strength and functional level. 1 repetition maximum is what I told you, what maximum amount you can lift 1 times. Okay, and 10 is maximum amount you can lift at 10 times. The 1 RM test is most commonly used by strength and conditioning coaches to assess strength capacities, strength imbalances, and to evaluate the effectiveness of training programs. Now, how can we calculate this repetition maximum? It can be either calculated directly using the maximal testing. For example, hit and trial method. The patient comes and you tell him to lift the load. The amount of load he is able to lift 10 times maximally, you will take it as 10 repetition maximum. Otherwise, the most popular and proven accurate one is the Brzezinski's formula, in which what we do is we take the weight of the patient and divide it by the multiplication of 1.00278 minus 0.0278 into the number of repetitions. For example, if you just manage to lift 100 kgs for 5 repetitions, you can calculate repetition maximum by the following formula. Okay, now For what are the steps we will follow? Choose which move you are going to test first. Then person warms up properly for 15 to 30 minutes. You can use cardio activities, stretching. Then person performs 6 to 10 repetitions of that chosen activity what you have chosen for the patient. Then allow the patient to rest for 1 to 2 minutes. Keep increasing the weight up to 80% of what you think maximum might be, and then person performs 3 repetitions. Then rests for at least 1 minute. After this, add weight in approximately 10% increments, and person attempts a single repetition each time, resting for at least 1 to 2 minutes in between each attempt. The maximum weight successfully lifted with good form and technique is taken as 1 repetition maximum. So there are many techniques we will be using here in PRE, many protocols. The basic 2 protocols are your Oxford's protocol and DLOM's protocol. So first we will be discussing about the DLOM's protocol. The concept of progressive resisted exercise was introduced mainly by DLOM almost 60 to 70 years ago, who originally used the term heavy resistance training, and later load resistance exercises to describe a new system of strength training. DLOM proposed and studied the use of 3 sets of 10 RM with progressive loading during each sets. Now, second person was the Oxford technique. In Oxford technique, it was designed to be used in reverse of what DLOM did. For example, I told you DLOM took 3 repetitions. So what he used to do was, first they used to determine 10 RM of the patient. And after that, first set was 10 repetitions at the rate 50% of the 10 RM. Second 10 repetitions in the second set, 10 repetitions at the rate 75% of the 10 RM. And then the third set was with 10 repetitions at the rate 100% of the 10 RM. Then Oxford technique, this was, as I told you, reverse of the DLOM technique. Oxford technique with regressive loading was introduced. The DLOM technique builds a warm-up period into the protocol, whereas this Oxford technique diminishes the resistance as the muscle fatigues. So what we do here is, we calculate the 10 RM first. Then in the first set, 10 repetitions of 100% of the 10 RM are given. In the second set, 10 repetitions of 75% of the 10 RM are given. In the third set, 10 repetitions of 50% of 10 RM are given. So both regimes incorporate a rest interval between the sets. Both incrementally increase or decrease the resistance. In a randomized study, when we compared both the regimes, no such difference was found. So we can use any one for resistance training. Here you can see the difference between the DLOMs and the Oxford. This is a progressively increasing resistance regime, and this is a progressively decreasing resistance regime. So it was based on, both are based on 10 RM. DLOM is designed for early rehab, for the beginning of the rehab, and builds up warm-up period. And these are this diminishes resistance as muscle fatigues. So this is a regressive loading exercises. Since the DLOM and Oxford systems of training were first introduced, numerous variations of PRE protocols have been proposed and studied to determine an optional intensity of resistance training, optimal number of repetitions and sets, optimal frequency, and optimal progressive of loading. In the same way, we see a new protocol, that is the Deptee protocol. Deptee protocol full form is the daily adjustable progressive resistance technique. Here this is mainly performed by the athletes, where the athlete must perform some progressive resistance exercises on a regular basis if an increase of strength is desired. So knowing when and how much to increase the resistance, this will be done. A common guideline is to increase the resistance by 5 to 10% when all prescribed repetitions and sets can be completed easily without the person getting fatigue. Deptee system is based on 6 RM. Working weights which we use, the adjustable working weights will be changing here. So what we are doing, we will be using mainly the 4 sets. In the first set, we will be using 10 repetitions of 50% of 6 RM. In the second set, 6 repetitions of 75% of 6 RM. In the third set, maximum possible repetitions of 100% of 6 RM. In the fourth set, maximum possible repetitions of 100% of whatever weight the patient is able to lift. Then one more technique is there, McQueen's. McQueen distinguished between exercise regimes for producing muscle hypertrophy and those for producing muscle power. He concluded that the number of repetitions for each set of exercise determines the different characteristics of the various training procedures. Here you could see, this is the McQueen's regime. You can give 10 repetitions of 100% of 10 RM in 4 sets, depending on how the patient can perform these techniques. So this is about the progressive resisted exercises. If you have any doubt or you want to ask any question regarding the progressive resisted exercises, you could ask. There are lots of researches about the number of sets to be given, whether we should give 3 sets, 6 sets, or we could give how many repetitions in a set, whether 12 repetitions or 10 repetitions or 6 repetitions. So every protocol has different sets. You can use any one, and every one is proved to have positive impact. It should be pointed out that the recommended increase or decrease in the adjusted working weights are based on progressive loading of the muscle group you are targeting. So anyone, if any question is there, you could ask me, you could text me, or you can WhatsApp me or mail me. Thank you so much. See you in the next class.